Are you using or considering GLP-1s? Did you know the right nutrition can help minimize some of those not so nice side effects, including acid reflux, nausea, the big C, constipation, and muscle mass loss? Want GLP-1 success without so many issues? These nutrition strategies can make all the difference. Coming up, find out 6 nutrients you need now.
Do you know what's in your vitamins? ProCare Health does. Made in the USA, at certified facilities, each batch is independently lab tested to ensure purity and potency. Why settle for less when you can have the most affordable, high-quality vitamins delivered to your door? Visit ProCareNow.com. Use code BSS10 to save 10%.
I'm bariatric dietitian Dr. Susan Mitchell. You're listening to the Bariatric Surgery Success podcast. I'm so glad you're here today. It matters where you get your nutrition information. And when it comes to bariatric surgery, nutrition is specific. You're in the right place, friend. So let's get started. Top shelf nutrition specific to GLP-1s and bariatric surgery tend to decrease some of those unwanted and sometimes downright awful side effects, including fatigue and muscle loss, acid reflux, nausea, constipation. If you're currently using or considering GLP-1s, whether with bariatric surgery or not, you want to know about the top 6 nutrients you need now and where to get them. Knowing and putting into action nutrition strategies can make all the success and all the difference in your success. So let's look at 6, what I'm calling them must-have nutrients if you use GLP-1s. Number 1, fluids. I hear a lot about fatigue from GLP-1s. One of the first things that I ask about is hydration. Are you meeting your fluid needs? Aiming for 64 ounces, which is close to 2,000 milliliters. If you've had bariatric surgery, you already know this to be true. Dehydration leads to fatigue, but it also leads to other issues such as constipation. After bariatric surgery, the 30-30 rule is smart, which separates food from fluid. With GLP-1s, the 30-30 rule doesn't matter as much because your appetite is decreased, sometimes significantly. You don't want to fill up on fluids where you're not hungry for food. So you have to be aware of the timing of your fluids so that you're hungry enough to get in the food that you need. So number 2, fiber. Can't poop? Well, you are not unusual. Constipation is an issue for both GLP-1 use and bariatric surgery. So think about this. You eat less food and less fiber because it's filling and you're not as hungry as you used to be. So using GLP-1s causes slow digestion. It's what's called gastroparesis. And gastroparesis is delayed emptying of the stomach. So this trifecta, if you will, of less food, less fiber, and delayed emptying of the stomach leads to that perfect storm. You can't poop. So you're also prioritizing protein, which I'm going to talk about in just a minute. You may not have enough room for all the higher fiber veggies and fruits that you need. So what to do? You want to make sure that the fruits and the vegetables you do eat are higher in fiber, such as apples, raspberries, blackberries, carrots, Brussels sprouts, pears, prunes, even beans and legumes. Getting as much fiber as you can in the fruits and vegetables that you do eat will help. And this, along with the fluid, the two together work to help prevent that constipation or to help deal with it if you have it. Now, you may find that you need a fiber supplement such as psyllium. Okay, think Metamucil for a boost if you can't get in enough fiber through food to prevent constipation. So hopefully there's a dietitian working with your GLP-1 provider. So ask what fiber supplement is suggested based on your individual case. Now, here's an important reminder. Come in close. I don't want you to miss this. anytime you add more fiber to your diet, you must increase water and other fluids too, so that your digestive system doesn't back up and feel like a concrete block. You want to add fiber foods slowly. When you're constipated, you want help and you want it fast, right? But when you add fiber foods too fast, guess what happens? Typically, a lot of uncomfortable gas and bloating. So remember, it's critical that hand in hand, fluid and fiber go together. Nutrient number 3, it's a gotta have, protein. Well, if you listen to my podcast regularly, which I hope you do, you know I preach it when it comes to protein. Just as with bariatric surgery, protein needs your priority. You'll likely require up to 100 grams and maybe over 100 grams, even closer to 120 grams. It will depend on your sex, your age, your health issues, all those various things. Again, that's why GLP-1s and the amount you take need to be dose specific to your case. If you have kidney disease, listen up. You can't eat the same amount of high protein or protein rich foods. So this is definitely a question for the dietitian where you get your GLP-1. These medications really require the knowledge and the skill of a dietitian. So again, kidney disease, you have to look differently at the amount of protein that you're taking in. When you're not hungry, it can be a challenge to even think about eating your protein rich foods. Let me just say, if you're not hungry at all and you barely want to eat, you may need your dose of GLP-1 adjusted. You've got to have good nutrition and food to prevent extreme muscle mass loss and malnutrition. And muscle mass loss is a big issue with both bariatric surgery and GLP-1 medications. So similar to bariatric surgery, eating a large portion of meat or fish can make you extremely uncomfortable because the GLP-1s, as we just talked about, slow down your digestion, that gastroparesis. So what to do in this situation? Well, same as with a bariatric lifestyle. Spread your protein intake out over multiple smaller meals and snacks. So you get the amount you need and you tolerate it a lot better. Well, you're probably thinking, can I use protein powder or shakes? You know me, I'm always a food first, but yes, both of these help fill in the gaps, especially when you need over 100 grams of protein and you're not as hungry as you normally are. So if you need more than 100 grams of protein per day, protein powders and pre-made protein shakes or shakes you make at home with protein powder can provide 20 to 30 grams of protein to fill in the gaps. Remember to sign up for my weekly newsletter called Breaking Down Nutrition. It's a quick way to keep up on nutrition for your bariatric lifestyle. You'll be the first to know about helpful nutrition tips and recipes, giveaways, product specials, and the latest podcasts and upcoming interviews that you don't want to miss. Sign up today on my website, breakingdownnutrition.com. Must-have nutrient number 4, calcium. Calcium is a nutrient of concern after bariatric surgery, and the same with GLP-1s. Why? When you lose weight, and a lot of weight rapidly, there is a decrease in your bone mineral density or how strong your bones are. Even a bigger deal if you are postmenopausal and you know you're at risk for osteoporosis. Well, how much is enough? You want to aim for 1,000 to 1,200 milligrams per day. Calcium really varies product to product, so you want to check the nutrition facts label or other information on the label of the product you use and do a quick internet search for the product and its nutritional value. Sometimes that's the easier way to find out just how much is in it. Yes, dairy products are rich in calcium. And other food sources are too, including dark leafy green veggies such as spinach, tofu, and sardines. Again, you may need a calcium supplement to meet your need, just like after bariatric surgery, and it's most likely that you will. Nutrient number 5, vitamin D. Vitamin D deficiency is common, so you may want to start a vitamin D supplement before you start the GLP-1. Ask the dietitian or provider about this. Vitamin D helps calcium, so they work as a team to be absorbed by the body, as well as plays a part in maintaining or building bone. So it's particularly important to get enough vitamin D when you'll be losing significant weight. Where do you find vitamin D in food? Fatty fish, such as salmon, as well as eggs, mushrooms, if they're exposed to UV light, which the package will usually tell you, and vitamin D fortified milks. But unfortunately, the list of vitamin D rich foods is short, so taking a vitamin D supplement will probably be necessary. Based on age and sex, the amount of vitamin D you need will vary. Plus, you may need more if you're at risk for osteoporosis. And nutrient number 6, vitamin B12. GLP-1s lower the vitamin B12 level in your body, partly due to the slower stomach emptying. But you may not get enough through food either while on this medication. Where do you find B12 in food? The best food sources are animal proteins, such as fish, lean meat, eggs, and dairy. If you're vegetarian or vegan, you're in an increased risk for deficiency. So consider nutritional yeast, also called Nooch, for vitamin B12. Make sure the product says it's fortified with B12, since nutritional yeast doesn't naturally contain it. You can listen to episode 160 for a lot more information on nutritional yeast. By the way, a low B12 level can make you fatigued, so you can see why lab work is so important. So here's what I want you to do this week. Come in close so you don't miss it. Ask yourself how well you're doing in terms of these 6 must-have nutrients. Where do you need to improve? What changes to your meals and snacks do you need in order to get foods that contain these 6 nutrients: fluids, protein, calcium, vitamin D, fiber, and B12? I also want you to suggest to your healthcare team that they do regular blood work or ask about regular blood work, because they should be doing it to check vitamin D levels and B12 levels, and even a body composition analysis to look at muscle mass loss. Why? Because you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell, or Practicalories, LLC.